Hey guys, it is Mrs. Malott. We're going to get started today. We're going to be talking about some of the disorders in the nervous system. We're going to be talking about peripheral neuropathy, spinal trauma, Guillain-Barré, myasthenia gravis, botulism, meningitis, and carpal tunnel syndrome. A lot of these we've already covered in different chapters of the book already, so we might not spend a lot of time on each one individually because you should know them from before. But the first we're going to talk about is peripheral neuropathy. This is actually not like one disorder, it's a group of disorders where the people's nerves are damaged, specifically their peripheral nerves. So that's basically anything outside of the brain and spinal cord. So it could be arms, legs, abdomen, anywhere really. And depending on which nerves are damaged, it could involve sensory or input damage. It could involve motor or output. It could be involuntary sensations like with the autonomic nervous system. So it just really depends on what nerves and where they're damaged as to what symptoms you may see. You might see things like muscle weakness, decreased reflexes. So when we use a reflex hammer, they're like barely moves, that kind of thing. Paralysis, pain, problems with blood pressure and sweating, digestive problems. Just lots of different things, and it can be caused from a number of things as well. It can be caused from trauma, like if somebody is in a car accident or falls off a ladder, things like that. It can be caused by diseases like diabetes. It's actually the most common cause of peripheral neuropathy. People who are diabetic have to frequently check the bottom of their feet to make sure that they are not getting blisters and things, because they can't necessarily feel them due to the increased levels of blood sugar in their body and things like that. It could come from kidney problems, hormonal balance problems, alcoholism. It could come from toxins and tumors and infections like shingles and the Epstein-Barr virus, and just a number of different things and a number of different symptoms. So it's kind of a generic or a broad kind of category for people with nerve damage. That's how I would summarize it. The next one is a spinal cord injury. You guys probably have a pretty good idea what that is, even though we never talked about it before. But this is when someone's spinal cord is damaged. Typically, it comes from a result of some kind of accident or violence, car accident, a gunshot wound, a knife wound, falling off a ladder, an injury from work, diseases, and things like that. As far as spinal cord injuries go, the majority or most of the injuries that you will see tend to be from people between the ages of 16 and 30, and mostly in male, or at least there's a higher incidence in males, just because, that are the people that are out taking risks, or out racing four-wheelers or racing cars or playing chicken with the train or what have you. They're a little more apt to take those risks than people who are older and have matured a little bit more and things like that. But about 10,000 spinal cord injuries a year happen. That doesn't mean that all of them are 16 to 30-year-olds by any means. An 80-year-old person could be in a car accident and have a spinal cord damage, what have you. But it's just that the majority are younger people. Now, when someone damages their spinal cord, they can range from bruising, which is kind of like the least severe. You can have your spinal cord crushed, but the worst is when your spinal cord is severed. If that's the case, then you're gonna have, typically have paralysis as a result. Typically, if you do injure your spinal cord, though, there's usually some kind of permanent damage in place. But with some of the injuries, especially more of a bruising type injury, the person may have their wounds and their symptoms heal over time. So yeah, that's what I'm going to talk about here with that. And that is all I have. That is a very short lesson. Okay. Let's maybe we'll start talking a little bit about the brain and cranial nerves. The PowerPoint listed a lot of the other diseases that we talked about before, like Guillain-Barré. So I'll just kind of quickly review them. Guillain-Barré is the one where the autoimmune disorder where your immune system attacks and you start getting paralysis from your feet up. Myasthenia gravis is the one that you start with the drooping of the eyelid and the progressive muscle weakness. Botulism is the food poisoning one. And then meningitis is inflammation of the meninges, which we learned about yesterday, and the different layers of the tissue that goes around the brain and spinal cord and the spaces in between them. And then carpal tunnel syndrome, which is when somebody has the median nerve in the arm compressed due to repetitive motion and movement. All right, so we'll just talk very briefly or get started on the actual parts of the brain. The brain is, of course, the control center of our body. It's kind of like the main processor, the computer of our body. There are nerves that come out of the brain. We said about the nerves coming out of our spine being called spinal nerves. The nerves that come out of the brain are called cranial nerves. Some of them are sensory, meaning they are providing information into the brain. Some are motor, which means they come out, and there are some that are both as well. The brain itself has 3 parts. You have the cerebrum, the cerebellum, and the brainstem. The biggest part of the brain, the part that you mostly think of when you see the brain, the top part, is called the cerebrum. It is divided into right and left halves. Now, it isn't smooth. It has bumps and grooves and things like that. The ridges or the high points are called gyri. The indentations or the bumps that, like the grooves that go down in, are called sulci, and together they're known as convolutions. So your brain is convoluted. That is so that the surface area of our brain is increased. If you would actually unpack that from your brain and lay it out flat, it would be about the size of a pillowcase. Now, the cerebrum is divided into different hemispheres, and then we name those hemispheres from the bones. So if you remember the names of the bones from when you had to label them in the skeletal system test, you'll do better on this part of the lesson as well. So the ones that are in the very front up here, this part of your cerebrum, is the frontal lobe. You need to know what each part is responsible for controlling. So this part of your brain controls your conscious thought and your speech and your motor activities or your movement and those kinds of things. Right behind this part of the brain on each side, you have the parietal lobes. These are the part of the brain that control our body's sense perception. So if I hold my hand out here, it's my body's ability to know that it's out there, that kind of thing, as well as your taste and some more areas that aid in speech. Behind that, at the very back of the brain is the occipital lobes. They are responsible for your vision. So the back of your head actually controls your vision. There's actually a nerve that kind of runs from right here directly into the back of your eye called the optic nerve that makes that happen. Now off to the side and down a little bit lower, down in this area, is your temporal lobe by your temporal bone. It's near your ear. That's the way to remember it. So it helps control your hearing as well as the integration of your emotions. There's also another section of your brain that's on the inside. It's not named for any of the bones that are nearby. That is called the insula. Now, our brain is controlled contralaterally. So the right side of our brain controls the left side of our body and vice versa. And that is where we're going to stop today. It's a 10-minute lesson, so we'll just kind of make it kind of short and sweet. But you can see there in figure 912 the different lobes being labeled and stuff. You don't have to label them for your test, but you do need to be able to tell me what each lobe of the brain is and what it controls. So you might want to kind of keep that straight in your head as well. So if you have any questions, please let me know. Otherwise, I will see you tomorrow.